Welcome again to Health Education with MKO Abimbola. Dr. Abimbola holds a doctoral degree in Physician Assistant Studies, and he is an advocate for the physician associate profession in Nigeria. Today, he writes on pancreatic cancer. The basics of pancreatic cancer. What is pancreatic cancer? Pancreatic cancer happens when normal cells in the pancreas change into abnormal cells and grow out of control. The pancreas is an organ that sits behind the stomach. It makes hormones and juices that help the body break down food. In Nigeria, pancreatic cancer is the 15th most common cancer, as it not very common. However, it is a lethal disease as it is difficult to manage due to a lack of awareness, late diagnosis, and a lack of access to proper care. What are risk factors for pancreatic cancer? Smoking or tobacco use. History of diabetes. Chronic pancreatitis. Stomach ulcer. Obesity. Helicobacter pylori infection. Chronic pancreatitis. Genetics or strong family history of pancreatic cancer. What are the symptoms of pancreatic cancer? Pancreatic cancer can be difficult to diagnose early because it often doesn't cause symptoms until it has spread to other organs. Symptoms include jaundice, a yellowing of the skin or whites of the eyes, itchy skin, darker urine, pale stools, unexplained weight loss. People might not feel hungry or might feel full after eating very little. Nausea, feeling full, foul-smelling stools, diarrhea. Bowel movements can look greasy or be difficult to flush in the toilet bowl. Constipation. Pain. People can have pain that spreads from their stomach area around to their back. The pain can come and go, and it can get worse after eating. Yellowing of the skin, called jaundice. Both the skin and the white part of the eyes can turn yellow. When jaundice happens in people with pancreatic cancer, it is usually because one of the tubes that carry bile from the gallbladder to the intestines is blocked. The gallbladder is a small, pear-shaped organ that stores bile, a fluid that helps the body break down fat. If a bile duct gets blocked, it can also cause your bowel movements to look grey instead of brown. These symptoms can also be caused by conditions that are not pancreatic cancer. But if you have these symptoms, tell your healthcare provider about them. Is there a test for pancreatic cancer? Yes. If your healthcare provider suspects you have pancreatic cancer, people with pancreatic cancer might be offered one or more of the following treatments. Surgery. Pancreatic cancer can sometimes be treated with surgery to remove the cancer. Before surgery, a doctor might do a procedure called laparoscopy. In a laparoscopy, a doctor will make small cuts in the belly. He or she will put a thin tube with a camera on it inside the belly to check whether there is a spread of cancer outside of the pancreas. Chemotherapy. Chemotherapy is the term doctors use to describe a group of medicines that kill cancer cells. Radiation therapy. Radiation kills cancer cells. Pancreatic cancer can sometimes be cured with treatment. This is most likely in people whose cancer is found at an early stage. Even if your pancreatic cancer cannot be cured, your doctor can treat your symptoms. For example, he or she can prescribe medicine, or a procedure called a celiac plexus block to reduce your pain. What happens after treatment? Following treatment, you will be checked every so often to see if the cancer comes back. Follow-up tests usually include exams, blood tests, and imaging tests. If the cancer comes back after treatment, you might have chemotherapy or radiation therapy. You might also get pain medicine or other treatments to help with pain. What else should I do? It is important to follow all your doctor's instructions about visits and tests. It's also important to talk to your doctor about any side effects or problems you have during treatment. Getting treated for pancreatic cancer involves making many choices, such as which treatment to have. Always let your healthcare providers know how you feel about a treatment. Anytime you're offered a treatment, ask, what are the benefits of this treatment? Is it likely to help me live longer? Will it reduce or prevent symptoms? What are the downsides to this treatment? Are there other options besides this treatment? What happens if I do not have this treatment? Pancreatic enzyme replacement therapy, PERT, can help with digestion and weight maintenance if you've lost weight. What is the prognosis of pancreatic cancer in Nigeria? The prognosis for pancreatic cancer in Nigeria is poor, with a high rate of advanced diagnosis and death. The 1-year survival rate is 20%. MKO Abimbola holds a doctoral degree in Physician Associate Studies from the United States of America. He is a Harvard Medical School scholar. He specializes in internal medicine, acute care, emergency medicine, geriatrics, psychiatry, and surgical services. Pancreatic cancer is dedicated to the memory of General Taoreed Abiodun Lagbaja. General Taoreed Abiodun Lagbaja, the 28th of February 1968 to 5 November 2024, was a Nigerian Army Lieutenant General who served as the Chief of Army Staff of Nigeria from June 2023 to November 2024. He was appointed on the 19th of June 2023 by President Bola Tinubu to succeed Lieutenant General Faruk Yahaya. Late Taoreed Abiodun Lagbaja was born in the town of Ilobu in Osun State on the 28th of February 1968. He spent his early life in Osogbo, where he attended the St. Charles Grammar School and local authority teachers college. Lagbaja was admitted into the Nigerian Defence Academy in 1987 as a member of the 39th Regular Course. He was commissioned as a second lieutenant on the 19th of September 1992 into the Nigerian Infantry Corps. Taoreed Lagbaja died in Lagos, Nigeria, on the 5th of November 2024, at the age of 56, after battling pancreatic cancer. He was married to Maria Abiodun Lagbaja, and they are blessed with 3 children. According to the Nigerian Army, he was a gallant soldier who placed the country first throughout his career and helped to curtail the Boko Haram insurgency in northern Nigeria. May he continue to rest in peace.